First, I'd like to thank you, Dr. Birx, for your service and for coming before the committee to testify today. Like you, as a physician, as a former director of the State Department of Public Health, I'm very concerned about the impact of the COVID-19 pandemic, the lockdowns, school closures that have had on adults and children, but like other members here, I'm also concerned about the loss of trust in our institutions that are so valuable. And I think that instead of having a committee hearing that is geared to try to lay blame at the feet of one administration, we have ongoing mistakes in our response to COVID-19, and all of those have to be examined, given my time in the military, having an after-action report so that we know what we did well, what we did not do well, how we could have better geared testing, so that we learn from this, because there will be another pandemic, and we don't know if it'll be 15 years between COVID-19 and H1N1, or if it will be more rapid than that, and if it will be overseas or if it will come here to our shores. Early in the pandemic, there was a lot of focus on limiting people's interaction with others, which was appropriate. However, by the summer of 2020, I would argue that the risks of keeping schools closed and how to reopen them as safely as possible was in fact known, and in Europe and Scandinavian countries, this was already being done. However, many Democrat-led states and blue states kept their schools closed, and the Biden administration listened to the American Federation of Teachers, causing, to me, irreparable harm to our students' mental, physical, and emotional health. And we have seen this in reports in suicides as young as 9 years of age. In fact, in February 2021, the New York Times found that 86% of pediatric disease experts recommended in-person schooling regardless of vaccination status. And in our state of Iowa, we opened schools to in-person learning in August of 2020 without significant repercussions or spread. Can you speak to the unintended consequences, mental health consequences, of lockdowns and school closures, especially in our younger students?
Let me make two comments quickly. We knew in July of 2020 the already impact of just having the schools closed March, April, May. When the head of SAMHSA came to the task force and presented the data about a rapid increase in suicidal ideation, I sent that to the CDC after she told me that the CDC was not utilizing that guidance and would not include it into the school guidance. So I wrote to Dr. Redfield and said, I really think your team should look at this and at least include it in the introduction so that school boards and family members can make informed decisions about the whole child. Secondly, we had universities, and I just want to thank presidents of universities who planned through the summer and use that time to create an effective plan to reopen. They understood that they were institutions of higher education, that their students could learn how to protect one another. And those universities that opened, that trust their students, that worked on a comprehensive plan, opened successfully, and all of them stayed open successfully except for the North Carolina system. They did that through active testing and making interventions and tools available. But most critically, and I think you do this in your opening, they made the knowledge available to students in real time about what was happening on their college campus so they could change their behaviors as necessary. And that is still not being done today at a local level to really make sure that every American knows what's happening in their community and how to mitigate against the virus.
Correct, and I would say more information is always better rather than trying to censor information that we don't particularly like. And as a physician, I was very forthright in my concern that there would be unintended excess deaths from our lockdowns and our closures and missing routine screenings. Dr. Birx, how much money does the U.S. donate to the WHO annually?
Oh, I don't know. There's the direct assessments, and then there's the additional funding that we provide through a whole series of agencies.
It's $500 million. And when did you first suspect human-to-human transmission of COVID-19?
In January, when I saw the social reports coming out of China.
And when did the WHO confirm human-to-human transmission?
Not until the middle to late January.
So they wasted some time. Did they parrot the Chinese propaganda, continuing that there was no human-to-human transmission?
You know, what was unfortunate to me is we all experienced the SARS. outbreak, and there was a level of transparency and integration of WHO personnel into China. And so we have to investigate why that didn't work.
So would you say that the WHO got this wrong?
I think very early on, when people should have been preparing, and certainly I was preparing Africa for a very significant pandemic.
And did you advise President Trump to withdraw from the WHO?
No.
Thank you. I yield back my time.